Hello, everyone. My name is Robert Johnson. I'm a nursing student with Nightingale College. Today, I'm going to be performing a video skill inserting a nasogastric tube. Um, Before we begin, let me go ahead and go over some of my equipment that I have here or supplies. I do have my 60 milliliter syringe, my MSN basin. Right, let's put that there. I have a pen light. I have tape. I have lubricating jelly. I have a safety pin. I'm going to use that for the clothing. This will be my makeshift specimen cup. I do have my pH test strips. And I have a absorption pad, as well as my 18 French nasogastric tube, my stethoscope, and my gloves. This will be my basin of warm water for the skill. And last but not least, this is my cup of water and straw that I'm going to be using for the patient. So now that I've confirmed that, I'm going to go ahead and check the physician's orders. The order does confirm that we're going to be using inserting a nasogastric tube for the purpose of suctioning the patient, for low flow suction for the patient, right? So I'll go ahead and go to the patient's room, introduce myself, knock on the door, knock, 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 pull the privacy curtain, hand hygiene. Hello, Mr. Jones. My name is Robert. I'm one of the nursing students from Nightingale College. Today, there's an order for you to have a nasogastric tube inserted into your nose. But before we go any further, can I go ahead and check your name and if you can verbalize your ID, verbalize your name and your full birthday, and as I'm checking on your ID band, okay? All right, so name is Raymond Jones, birthday March 10th, 1965. Thank you, Mr. Jones. So as I was saying, there's a doctor's orders for you to have a nasogastric tube inserted into your nose. As you are aware, you recently had gastric surgery, and the doctor just wants to make sure that you're going to have a very efficient healing process. So he wants to empty out all of your stomach content to give your stomach a rest. In the meantime, it's just going to drain everything out. Okay? Do you have any questions about that? No? Okay. Gotcha. So before we begin, I'm going to be prepping everything. So I'll start by doing hand hygiene, right? And I'll go ahead and put my gloves on. But Mr. Jones, do you have any type of nasal irritation, stuffy nose, or anything like that right now? Or any cold or anything? No? Okay. Gotcha. Good. Thank you very much. So what I'm going to do, got my gloves on. I'm going to go ahead and put this tube into the warm water to make it more pliable when I'm inserting it. And then I'll go ahead and put the absorption pad on Mr. Jones here, right? Or the towel. And then I'll go ahead and I'm going to raise Mr. Jones' head to a high Fowler's position. And I'm going to have Mr. Jones hyperextend his head all the way back. Okay, Mr. Jones, I just want to look into your nose and check in your mucous membranes, making sure there's no irritation, making sure there's no type of lumps or anything that looks unusual or extraordinary. Let's see here. There's no redness, no irritation, no swellings or anything like that. That's good. And Mr. Jones, can I have you press one side of your nostrils and breathe in? Breathe in and out of your nose. Good. Okay, can you do the same thing with your other side? Hold down the nostril, breathe in and out of your nose. Okay, so it appears that your right side is a little bit more clear, right? That's the side we're going to use. All right. So, do you have any questions? No? Okay, gotcha. So I'm going to get my tube, my nasogastric tube out of the warm water. I'm going to measure it. We're going to go from the tip of the nose down to the earlobe. And then from there, we're going to stretch it all the way down to the xiphoid process, right? And it looks like we are at 50 centimeters. We're at 50, right? So what I'm going to do is I am going to tape that off. You could mark it off with tape. I'm sorry, with a marker, but I'm going to use tape. And the reason why I'm using tape is that if you ever look at one of these tubes, the number is only on one side. And you want to make sure that while you are putting that tube in the patient's nose, that you don't want to go too far or too short. So you want to be able to, if you can't just look down at those numbers, because you never know if it get twisted or anything like that as you're putting it in, you want to at least be able to feel for it. So I'm using tape so I can feel the location, and it's at 50, right? So, Mr. Jones, how this is going to work is I'm going to have you hyperextend your head all the way back, and you're going to feel like you're going to gag. And during this process, when you feel like you're going to gag, after I insert it into your nares and into past your nasal pharynx and then into your oral pharynx, you're going to feel like you're going to gag. And then I'm going to have you lean forward, take a sip of water, and each time you take a sip of water and swallow, I'm going to insert this tube at least about 2 to 4 inches until we get down to your stomach. Okay? Any questions at all? No? Okay. So you want to always look at the tube, and you want to look at the natural curvature of the tube, and that's the way you want to insert it in so that it goes in alignment, right? You don't want to do it upside down or anything like that, because that can be very painful for the patient. All right? So be mindful that although the patient breathed out of his nose and it was clear, anything can happen. There could be some other obstruction a little further down. And if that happens, we would have to pull the tube out, start again in the other nostrils, right? So, Mr. Jones, go ahead and tilt your head all the way back. And we're going to go ahead be mindful that once I tilt your head forward, I want you to grab that water, take a drink, and each time you swallow, I'm going to go ahead and insert deeper, okay? So here we go. I lubricated the tube. Got lubrication on the tube already, right? Just want to make sure you guys know that I lubricated the tube. And here, we're going to go ahead and go in, right? We're going to insert, right? Okay, starting to gag, lean forward. All right, good. Now take a sip of water. Okay, I'm going to advance 2 to 4 inches. Good. Take a sip of water. Doesn't seem like there's any problems. Good. Are you okay, Mr. Jones? Yeah? Okay. If there's any problems, please wave your hand to get my attention, okay, for me to stop, and I will stop, right? So go ahead and take a sip of water. We're going to advance it more, 2 to 4 inches. Good. Sip of water. Good. And 2 to 4 inches. Take a sip of water. And good. So we're at the 50 mark on the tape. So I'm going to have you relax a little. I am going to check the location, or check where we are by testing the pH levels of the stomach content. So I'm going to use my 60 ml syringe, and I'm going to aspirate at least 5 to 10 milliliters. I'm going to put that, switch it around, and I'm going to put that inside of the specimen cup. Good, that's in the specimen cup. And then using the pH strip, I'm going to test the pH levels, and it should read between 1 and 5. That's what we're looking for. Good, that reads between 1 and 5. Okay, so we're in the right spot. So from there, I'll go ahead and close this off for now, and I will tape it up, right? So I have my stethoscope here. Just FYI, some facilities want you to use the stethoscope to actually use about either 30 to 60 mLs of air. And I'm going to use the other tape. 30 to 60 mLs of air, and inject that into the stomach, into the patient's stomach, and then you are to listen to the stomach with the stethoscope. Our facility wants us to use the pH strips, right, as the first part. The second part, we will actually have to go down and get the patient, make sure we get an x-ray. That is the final call once we get that x-ray going, right? So I'm just going to use a figure 8 type of wrapping, right, on the patient's nose to stabilize it. Okay, and make sure that that's stabilized. I'm going to use another strip of paper tape. I'm going to go from the bridge of the patient's nose, and we're going to go all the way around. Okay, that looks secure. Now, We're going to call down to X-ray. X-ray is going to come up, get Mr. Jones, and yeah, they're going to confirm the location of it. But before I let Mr. Jones go, as X-ray is on their way, I'm getting him comfortable. I'm going to remind Mr. Jones that because he's got this nasogastric tube in, this is considered like another form of aspiration precaution. We don't want him to go all the way down flat. So although I'm going to lower the level of his bed, I'm not going to flatten out his bed. I don't want to go below, let's say 35 degrees lower, right? Just as a safety precaution, right? So Mr. Jones, I'm going to go ahead and document. Well, I'm going to go ahead and clean up this area for now while X-rays is coming. I'm going to do my hand hygiene, and I'm going to make sure Mr. Jones is comfortable. Call light in place until X-ray gets here, because I may have to actually go down with him. Do my hand hygiene. Clean up the area. Hand hygiene. Document my findings. Document my assessments. Document any type of discomfort that Mr. Jones may have had through this. Also, I'm going to document any content that, or the color of the of any content that may come out, right? I'm going to document that and the amount. Mr. Jones went out to X-ray. They confirmed the tube is in the right spot. Now that tube is in the right spot, I'll communicate with the doctor to see if he wants me to continue on and go forward with setting up Mr. Jones with a low flow suction to empty out his stomach content. So Mr. Jones hooked up. So the way I'm going to care for this tube is daily. I'm going to, not just daily, but every shift, I'm going to make sure that I communicate with the team members, such as the NAP, making sure that they notify the nursing team, notify me, if this tube has moved any bit. For example, I want to show them where we're looking at. I want to make sure that it stays at that 50 mark. If that 50 mark tape goes, or the markings, is found anywhere else further down, then we need to make sure we address that immediately. It's a safety issue. We want to always use the clothespin. The clothespin is going to be used to attach the tube to the gown. And when that's attached to the gown, that's another safety measure, making sure that that tube doesn't move. Now that we're hooked up to the suction, right, we want to make sure, first of all, we want to make sure that this tube always stays patent and ready to use. And when we hook it up to the suction, what we're going to be doing is we're going to be document the content, the consistency, and the amount of fluid, of gastric liquids or gastric fluid that comes out. We want to document the color of it and the consistency of the thickness of it. If it's watery, we want to document the amount and or any type of discomfort. At any point, if Mr. Jones feel that this tube is in the wrong spot, we may have to even get another X-ray. But as I said, we're going to monitor this daily. We're going to monitor the location of it, making sure that it's in the right spot, and we're going to monitor the content that's in it. And then from there, I'll go ahead and clean up my area after the whole suction thing, and document everything that comes out every shift, and document. I'll go document, and of course hand hygiene, and then document. All right, thank you very much.